Here is an example of one warm-up you can do before practice or competition, and it should only take 15 to 20 minutes. If you would like to see other examples of exercises or full exercise programs, please visit our YouTube channel, Adapted Sports Injury Prevention. If you experience pain during any of these exercises, we advise you to stop. Each exercise can be modified accordingly based on each person's limitations. The first set of exercises are 2 mobility exercises. Mobility is extremely important in wheelchair tennis in order to prevent injuries and give you maximum power behind your swings. The first exercise is a pec stretch. In order to stretch these muscles, you are going to position your chair next to a fence or pole. You will place your arm and elbow in a 90-90 position and rotate it in and away from your arm to make the stretch more dynamic. Dynamic stretches are good to do before practice or a game. We will perform this stretch for a minute each side with 3 to 5 second holds. You're going to want to grab a partner for the next exercise. Now we are going to do a back-to-back ball toss. Place the back of your wheelchair against the back of your partner's, and you will rotate and pass the ball back to your partner. Complete 20 repetitions of this exercise, 10 on each side. This exercise works on mobility of the thoracic spine as well as activating the oblique muscles. In today's workout, there are 3 strengthening exercises. Unless otherwise noted, each exercise is done for 2 sets of 8 to 12 repetitions. If you have difficulty stabilizing yourself during any of the following exercises due to a lack of core activation, you can complete the exercise one arm at a time while using your other hand on the chair to help stabilize yourself. These strengthening exercises should be performed at an RPE between 12 and 15. If the athlete identifies the intensity of the exercise below a 12 on the RPE scale, the exercise should be progressed by something more difficult by using a band with a higher resistance. If the athlete identifies the exercise as above 15, then the exercise should be regressed by using a band with less resistance. The first strengthening exercise is a face pull. The wheelchair is positioned to be facing the attachment of the band. The athlete in this clip is in a sports chair, so we have another person assisting in stabilizing the chair. This athlete has some use of his legs, so he can also help brace himself. The resistance band is anchored so that the hands are slightly higher than the shoulders with the elbows straight. Pull the band, bringing the elbows back first and then the hands up and back. At the end of this motion, the thumbs should be pointing back behind the athlete. This motion should be slow and controlled. By anchoring the band above the head, we increase the demand on the lower trapezius, an important mover and stabilizer of the shoulder blade. Common compensations during this exercise include protracting the neck forward, shrugging the shoulders towards the ears, flaring of the ribs, and pushing the chest out. This exercise is primarily progressed and regressed with the strength of the resistance band. The second strengthening exercise is a row with thoracic spine rotation. To set up this exercise, make sure the wheelchair is facing forward and locked. A band should be attached at or slightly below the level of the shoulder. The wheelchair should be positioned far enough away to have adequate tension in the band. This exercise will be performed unilaterally. The athlete will perform a row with simultaneous rotation towards that same side. The athlete should focus on squeezing the shoulder blade down and back. Also make sure to keep the shoulder from shrugging toward the ear to avoid overusing the upper trapezius muscle to complete this exercise. This is a common compensation and may appear when the patient is fatigued. To progress this, resistance can be increased by using a stronger band or placing the wheelchair farther away from the band attachment. To regress, resistance can be reduced by using a lighter band or placing the wheelchair closer to the attachment. It can also be broken down into 2 components, by first performing a row and then adding in a rotation. The final strengthening exercise is the Pallof press and is performed each day of the program. To set up this exercise, the wheelchair will be facing forward and will be locked, or if in a sports chair, locked from moving. A band is attached at or just below shoulder level to the side of the athlete. The Pallof press is performed by grabbing the band with both hands and pulling the band to the center of the chest. While keeping the band in line with the chest, extend your shoulders and elbows out in front of you. The band is pulling the arms and trunk towards the attachment, and the goal of this exercise is to resist the rotation and maintain facing forward while keeping the arms at midline. Similar to the previous exercises, This exercise can be made more or less difficult by changing how close to the attachment you are, or by changing the resistance of the band. Additionally, this exercise can be progressed by incorporating a rotation away from the anchor point. As an alternative, if core activation is an issue, the athlete can try to draw circles or spell out the letters of the alphabet while maintaining the pressed position. The next exercise focuses on dynamic stabilization. This exercise will help activate muscles that stabilize the shoulder girdle and make a great warm-up before beginning more intense strengthening exercises or sport-specific play. This exercise is performed for 1 minute per arm. This can be progressed by increasing the time of the exercise or by using a heavier ball, although the ball will still need to bounce. The exercise can be regressed by decreasing the time or by using something lighter like an inflatable beach ball. This exercise should fall between 12 and 15 on the RPE scale. If the athlete identifies the exercise below a 12, then it is too easy and should be progressed. If they identify it as above a 15, then it is too difficult and should be regressed. The wheelchair will be positioned facing the fence and may require assistance to block the wheelchair from rolling. The chair should be as close to the fence as possible to allow proper positioning of the arm. The shoulder is positioned overhead in full flexion. In this position, it's common for athletes to shrug their shoulders up towards their ear or drop their arm out towards the side as they fatigue. Maintain proper positioning throughout the exercise to ensure activation of the lower trapezius and other stabilizing muscles. This exercise can also be performed using a TheraBand. For this, the wheelchair should be facing away from the fence and the TheraBand should be attached above the shoulder in line with the hand when the shoulder is in full flexion. You can tie a loop in the band and place it around the wrist if the athlete has limited grip strength. The final set of exercises are sport-specific drills that you can perform before you start playing on the court. Incorporating sport-specific drills is a great way to prepare your body for the demands on the tennis court, such as wheelchair mobility, agility, and proper wheelchair propulsion mechanics. Replicating the demands of wheelchair tennis play during warm-ups can help decrease your risk of injury. The first drill is called the fan drill. You will need 6 cones set up in a half-circle configuration with 1 cone at the center and 5 cones surrounding it with equal spacing in between the 5 cones. The 5 cones should be about 5 to 6 feet away from the center cone. However, the spacing can be altered in order for the athlete's wheelchair to fit in between each cone. Once the cones are set up, the athlete will be instructed to maneuver around the cones in a figure 8 pattern in the direction from the left to right cones of the fan, always returning to the center cone. This is then repeated in the opposite direction, doing figure 8s around the cones of the fan right to left, always returning to the center cone. The last drill is called 12 to 9 court pushes. This drill promotes proper wheelchair propulsion mechanics while gradually getting the body ready for explosive wheelchair pushes. The athlete should place their hands at the 12 o'clock position on the wheelchair and move them from the 12 to 9 o'clock positions during propulsion. The athlete is instructed to propel forward at 25%, 50%, 75%, and then finally 100% of their max speed along the length of the court. The athlete should start pushing forwards 25% effort down the long end of the court. When the athlete reaches the end of the court, the athlete turns around and proceeds to pull backwards along the short end of the court for active recovery. Next, the athlete should push forwards down the opposite side of the court, pushing at the next higher percentage, in this case, 50%. This will repeat until the athlete is pushing at 100% effort.